Today's medical-centric topic is teeth scaling. What you need to know. Teeth scaling, also known as dental scaling or deep cleaning, is a common dental procedure aimed at removing plaque, tartar, and bacterial deposits from the teeth and gums. It is an important preventive and therapeutic measure in maintaining good oral health and preventing gum disease. In this video, we will explore what teeth scaling is, its benefits, the procedure involved, and what you need to know before and after treatment. 1. What is teeth scaling? Teeth scaling is a professional dental cleaning procedure performed by a dentist or dental hygienist. It involves the thorough removal of plaque and tartar deposits from the tooth surfaces, including below the gum line. The process helps prevent gum disease, reduces the risk of tooth decay, and promotes overall oral hygiene. 2. Benefits of teeth scaling. Teeth scaling offers several important benefits for oral health, including removal of plaque and tartar. Plaque is a sticky film of bacteria that forms on the teeth and gums. Tartar, or calculus, is hardened plaque that cannot be removed by regular brushing and flossing. Teeth scaling effectively removes these deposits, reducing the risk of gum inflammation, decay, and bad breath. Prevention of gum disease. By eliminating plaque and tartar buildup, teeth scaling helps prevent or treat gum disease. It reduces the inflammation of gums, gingivitis, and prevents its progression to a more severe form known as periodontitis. Improved oral hygiene. Teeth scaling enhances oral hygiene by providing a clean surface for regular brushing and flossing. It helps maintain healthy gums, fresh breath, and a bright smile. 3. The teeth scaling procedure. The teeth scaling procedure typically involves the following steps. Evaluation. The dentist or dental hygienist will assess your oral health, including examining your teeth and gums, and may take dental x-rays if necessary. Scaling. Using specialized instruments, the dental professional will carefully remove the plaque and tartar deposits from the tooth surfaces, including below the gum line. This may involve manual scaling or ultrasonic scaling, depending on the individual's needs. Root planing. In cases where gum disease is present, this process involves smoothing the tooth roots to promote gum tissue reattachment and prevent further plaque buildup. Polishing. After scaling, the teeth will be polished to remove surface stains and give them a smooth and shiny appearance. 4. Precautions and aftercare. To ensure optimal results and minimize discomfort, it's important to follow these guidelines. Inform your dentist about any underlying health conditions or medications you are taking before the procedure. Local anesthesia or numbing gel may be used to minimize discomfort during scaling. After the procedure, you may experience temporary sensitivity or gum tenderness, which can be managed with over-the-counter pain relievers or prescribed mouth rinses. Maintain good oral hygiene practices, including regular brushing and flossing, to prevent the buildup of plaque and tartar. Schedule regular dental checkups and cleanings to maintain the health of your teeth and gums. Teeth scaling is a vital dental procedure for maintaining good oral health and preventing gum disease. By removing plaque, tartar, and bacterial deposits, teeth scaling promotes healthy gums, reduces the risk of tooth decay, and enhances overall oral hygiene. Understanding the procedure, benefits, and necessary aftercare will help you maintain a healthy and beautiful smile for years to come. Remember to consult your dentist for personalized advice and guidance regarding your specific dental needs.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.